Thank you for joining me today. In this video, you will learn psychiatric interviewing, history taking, mental status examination, and we are going to go over that. So, the purpose of psychiatric interviewing is cornerstone of a diagnostic and prognosis and treatment. Because the psychiatric interview is the cornerstone of the diagnosis, prognosis and treatment. It builds therapeutic alliance with the patient. Interview itself is a part of the treatment because you want to listen the patient. We talked about different video. I talked about active listening. So interview itself is a therapeutic and it builds therapeutic alliance. It is used across the setting: inpatient, outpatient, emergency, nursing home, correctional setting, and it emphasizes a biopsychosocial and personal-centered care. So interviewing is the part of the treatment. It is the cornerstone of a diagnosis, prognosis, and treatment. It builds therapeutic alliance. Interview itself is a part of the treatment. So the general principle is based on that is agreement as to progress. You want to agree with the patient that you want to proceed the treatment, the role and the purpose and the time and consent. The part of the interview include the agreement as to proceed. What are you going to do? You will tell your role. I am the provider. You will tell them that you are the provider and you will say your role. And then the purpose of the interview, you will tell the patient the purpose of the interview. You will tell them the time it will take, and then you will take their consent. And voluntary or involuntary, you will mention that if this interview is a voluntary or involuntary. You will write down and you will mention that. You will provide privacy and confidentiality. You will follow the HIPAA rule. Limits the danger. HIPAA limits the danger to self and others. Forensic expectations. You will provide respect and consideration. You will reduce the anxiety, stigma, and sensitivity when you are conducting this kind of interview. You will report and empathize. You will verbally and non-verbally maintain objectives. Avoid over-identification. You will be objective. Safety and comfort. You will provide and make sure the safety and comfort of the patient. Physical safety, you want to make sure and maintain the physical safety. Environmental safety, you will Be aware of the agitation and anxiety and the discomfort. Mostly time and the session, they take 45 to 90 minutes typically, short for acute and psychosis patients. If the patient is in psychosis and they are experiencing acute manic or acute psychosis, the session and the time will be less. Process of the interview. Before interview, you will triage urgency, referral session, and record the review and medication. Before you conduct the interview, before you conduct the psychiatric or any interview, physical or mental, for the patient, you will triage the urgency. If this acute, what do you prepare for that before you come to the patient room? You will check if there is a referral needed. You will review the record and the medication before you come to the patient room and conduct the interview. Waiting room tasks. When you come to the waiting room task, you will conduct with the demographic, HIPAA, symptoms scale. You will give them sheet that they will fill out how they feel, that will assess them their symptom scale. If they are anxious, you will give them BQH9. Also, you will give them QIDSR. Before they come, you will give them those phones when they are in the waiting room. Interview room setup. You will have a soundproof minimum distraction, equal chair height, 4 feet apart. You want to be 4 to 6 feet apart from the patient. No desk barrier, because you want to see the patient face to face. You will initiation. You will begin with warm introduction and preferable name. You want to ask them, you will introduce yourself, you will ask them their preferable name and your preferable name, and then you will begin with open question. What brings you here today? That's how you begin. And then the structure of the interview will be identify the data. You already checked the patient and their age, their name, their status, and then source reliability, chief compliance. You will conduct the chief compliance in the patient's way. Even though before you admit them, you know that's what they come with, you want to make sure that they tell you this is what they come for. Also, you will interview the history of present illness, past psychiatric history, substance use and addiction. You will ask all that. It will be part of the interview. You will ask them the family history, if they have a family history of psychiatric or medical, developmental or social history. You will interview them, review of the symptoms. You will start from top to bottom. You will also conduct a mental status examination, MSE, and then you will do the physical examination. When you do the mental, then you will do the physical examination. You will do then formational, and then you will also conduct the DSM-5 diagnosis criteria, and then treatment plan. For the history of a present illness, you will do chronological symptom development, severity of the symptoms, duration of the symptoms, triggers of the symptoms, stress factor. You will ask them stress factor of the symptoms. You will also assist the functional impact and coping mechanism. What do they use to cope? How the symptoms affect you? How do you cope with the symptoms? Prior treatment and respond to treatment. You will ask them if they had a prior treatment, and you will ask them how did that work for you, and why the patient is seeking help now. If they've been treated before, what is the reason that is new now that they are seeking for help now. And then psychiatric interview symptoms. You will do the mood for depression by using a Psychiatric symptoms, and then manic irritability. That's how you're going to assess or review if they have a psychiatric for depression, manic irritability, and then anxiety. You want to assess if they have a general anxiety disorder, if they have a panic disorder, if they have PTSD, if they have OCD or phobia. You will ask that anxiety. Also, you will assess the psychosis. Are they hallucinating? Are they delusional? Are they paranoid? You will assess that and review that. Others will be, do they have ADHD? Do they have eating disorder? Those are the assessments you want to conduct. And then the past psychiatric history, you want to assess if they have, or interview them if they had a prior diagnosis of any psychiatric history, if they've been hospitalized, what kind of therapy do they had, medication that they are taking, or how many medication they've been tested on or tried or been prescribed to for their psychiatric illness. What was the dose, duration. You will interview the patient, and also you will review their medical record. You want to review the dosage of the medication, duration of the medication, how long they've been having, how long responded that they get, what kind of side effect did they experience. You will also assess any suicidal ideation, any intent, plan or attempt or violence, or then you will assess the homicidal, you will assess the non-self-harm, and then substance and addiction. You will assess alcohol, if they have alcohol abuse or addiction, drugs, prescription, if they have, what kind of route they take. Do they take oral, IV, how frequently they take. You will ask it those questions. It will be part of the interview. Tobacco, have they ever taken any tobacco, cigarette or nicotine, coffee, gambling, eating disorder, internet. You will also interview their tolerance and withdrawal symptoms, how that impact on them, functional impact, and readiness for change. Are they now ready to get treated? And you will assess their readiness. Then you will assess family history, developmental history, social history, psychiatric and medical illness in the family. You will assess the prenatal or birth history, milestone when they were children, if they have a developmental delay, if they have ADHD, school or work or financial or housing. You will ask them their situation and their history also, social history, that include the social history, the school and work and housing, relationship, legal issue. You will ask it the culture, influence. You will ask them. You will screen any other illness. Mental status examination. You want to assess the appearance. You want to assess the behavior, motor activity, speech, mood, and affect. You want to assess their thought, content, if they are having a delusion, or if they are OCD. If they have OCD, you will also assess the thought process, linear, tangential, flow of idea, loose association, perception disturbance, cognition. You will assess if they are oriented, attentive, their memory, calculation, abstraction. You will assess that. You will assess their insight and judgment. Physical examination. You will assess the vital signs, BMI, weight conferences, neuroleptic screening and also neurological screening. You will assess AIMS for antipsychotic monitoring if they take an antipsychotic medication. You will also assess the medication causes. Always consider before psychiatric diagnosis. Treatment plan. You want to assess the biopsychosocial synthesis, differential diagnosis, professional diagnosis, safety assessment, level of care. You want to assess the level of care also. You want to make this share decision making. You want to get their consent for the treatment, for the interview, for the medication. You have to have the consent to do any step. Referral. You will consider referral psychotherapy if you are not specialized in that area. If you specialized and you have the time to do that, of course you are not going to refer them, but otherwise you will refer them psychotherapy, substance treatment, social support, family involvement with the consent of the patient. Interview the techniques include the facilitating reflection of you reflect what they told you, and then you summarize what they told you, and then you will encourage them to elaborate. Could you tell me more about that? You will encourage them to say more about what you don't understand or what you want to clarify. You will acknowledge the emotion. Therapeutic listening, you will listen when you need to. Non-verbal agreement, you will agree with them where you agree with them. Not always, but you will understand the emotional and the difficulty they are going through. Extending, you will clarify, associate, transition, and obstruct, avoid. Excessive, you will avoid excessive and or why questions, you will avoid that. You will avoid judgment, minimize statement, premature advice or interruption. You will avoid that. You don't want to advise them before you know the full story. Poor non-verbal clues, you will avoid that also. Thank you for joining me today. I hope you gain knowledge from the video. Please subscribe and join me in my next video. Thank you.